And that all could happen sooner than expected. Officials say if we don't act now, our hospitals will be overwhelmed in a matter of weeks. That's also why they're asking everyone to take this shutdown seriously. Lindsay Nadrich spoke with OHSU's chief medical officer about what the healthcare workers are seeing right now.
Doctors and nurses are sounding the alarm now because what we were doing wasn't working to slow the spread of COVID-19. Cases continue to surge and hospitalizations follow shortly after. First, it's important to remember as people get COVID-19. Doctors say it takes about 7 days for symptoms to peak. So there's a lag between the number of cases and the number of people in the hospital, which means right now hospitals are bracing for a surge of patients as case numbers hit record levels.
So the Oregonians that are getting infected now and the numbers that we're seeing now are the numbers that we'll see increasing hospitalizations more like 2-3 weeks from now. And so that's why we're concerned about the additional numbers that we know are on the way.
OHSU is already at 89% capacity in the ICU and is 93% full in all other beds. But it's not just available beds. It's having enough staff to care for everyone.
But as more and more patients need to be seen, this is leading to physical and emotional exhaustion for our healthcare providers, and that they only have the capacity to care for so many patients.
It's understandable that 9 months into this pandemic, healthcare workers would be exhausted. They're working 12-plus-hour shifts and are also at risk for getting COVID-19 out in the community like the rest of us.
COVID is extraordinarily difficult for all of us. Everyone is tired, they're burned out, a little frustrated and wishing that they could get back to what we call our normal worlds.
That's why OHSU's Chief Medical Officer, Dr. Renee Edwards, is urging people to think of doctors and nurses when you consider whether or not to visit friends these next 2 weeks or have people over for Thanksgiving. Edwards says her staff needs a break, but they're not going to get that unless we all do our part to stop the spread. Finally, if hospitals fill up with COVID patients, that also means people can't get in for other surgeries and needed care. Edwards tells me they're managing right now, but they're concerned 4 weeks from now things will become critical if we don't all do our part. I'm Lindsay Nadrich, Point 6 News.